Hello and a very warm welcome to this second session of the ISNTD Climate and Health Conference. We just kicked off earlier on this morning with our first session. Perhaps you were there, perhaps you only just joined us now. In any case, a very warm welcome. It's been a really exciting start to these discussions, bringing together these two very different fields, which are climate and health, and particularly neglected tropical diseases. And what we've already heard this morning is there is a lot of room for cooperation, but also a lot of gaps remaining. And yet within that, particularly the neglected tropical diseases field really has an important role to play when it comes to thinking about climate change and also mitigating and addressing the impact of climate, and just more generally, the resilience of the communities that are most affected. So it's been a very productive morning, and we heard a lot of messages on a very kind of global and international scale. One of the presenters, Dr. Mark Booth, then brought us a bit more into the local arena, really thinking about climate on a local scale. And in this session, we're really excited because we're going to delve into a few more of the projects and the research and the collaborations that are actually, number one, bringing together the two approaches, particularly with very exciting kind of surveillance and artificial intelligence techniques and methodologies, but also drive really wonderful pleasure to have a very international and mixed panel. We are joined here live by Dr. Do-Hyung Kim. Hello, Do-Hyung. Thank you for joining us. You are lead data scientist at UNICEF. Nice to have you here. We will
nice to meet you.
Thank you, and same. We're also joined by Hanoch Barlevi. You are working with climate and data for child resilience at UNICEF. Thank you for being here. And we also have Dr. Ayman Ahmed from the Directorate of Environmental Health from the Sudan Federal Ministry of Health, and also team leader in Outbreaks investigation and risk assessment. So thank you for joining us today. And hopefully in a few moments, we will also be joined by Dr. Rochelle Schneider dos Santos, Artificial Intelligence Application at the European Agency, and to present us some work about the use of AI in dengue prediction models. So without any further delay, I'm going to hand over to our speakers for some really interesting projects, and we'll come back at the end of all that for some questions and discussions. So to all of you attendees here in the audience tuning in today, please do post your comments in the chat. Please do post any questions you may have, and all importantly, say hello. Tell us where you're tuning in from. It's always lovely to see where everyone's from. So thank you very much. In the meantime, over to you, Do-Hyung, and thank you for being here.
I thank you so much for joining, and I thank you so much for this opportunity to introduce about our effort to use AI-based model framework to see the relationship between the climate change and dengue prevalence. So again, my name is Do-Hyung Kim, and working as a lead data scientist at UNICEF, and I'm joined by my colleague Hanoch Barlevi from UNICEF as well. So let me hand over to Hanoch so that he can briefly introduce about the context of our work.
Thank you, Do, Marian, and distinguished participants. Honored to participate in such an interesting conference. Also to start, and Marian, to say that the interesting thing is that it's not by coincidence that we are today talking about health and climate, as we're realizing that they are getting more and more close to each other, and therefore we have to start changing a bit of the way we are looking at both climate as well as the public health sector. And starting with the dengue, we all familiar with, probably today we hear about the dengue. The fever is one of the most common and rapidly spread arboviral disease in the world. as a major public health and socioeconomic consequences. We started and investigated a bit further in the Amazon basin, as UNICEF working with government and different entities on that subject. And just to get a bit of a background, it is important to understand that that comes also from the climate perspective. According to the IPCC working group for the Latin America and the Caribbean, as part of the assessment report, the sixth assessment report, the climate change affect the epidemiology of climate-sensitive infectious diseases in the region and as in other regions. Example includes the effects of the rising temperatures on increasing the feasibility of transition of vector-borne diseases, including the endemic and emerging arboviral diseases such as the dengue, chikungunya, and Zika. For example, the production of potential for dengue transmission increased between 17% to 80% for period between 1950-54 and 2016 to 21 respectively. Depending of course on the sub-region as a result of changes in the temperatures and the precipitations and other factors that we will learn today. More specifically, and we delve a bit more into the Amazonian Peru, a region that's called Ucayali. What we learn is that really the main vector-borne disease are those transmitted by the Aedes aegypti that you probably all familiar with, the dengue, Zika, yellow fever, chikungunya. The vector Aedes aegypti is sensitive to changes in temperature and precipitation as we learning with the time, and therefore we could also start to anticipate the different and the changing reaction and behavior. For that extent, the Ministry of Health in Peru in 2016 conducted a technical assessment how climate change is in fact affecting the public health situation in Ucayali region, and managed to identify risk and recommendations on the anticipating health risk under the climate change and on all the variabilities related to. And that is where we are coming next, please, Edo. And that is where we are coming a bit, we as UNICEF, in supporting government, in particularly the health sector. And what is the hypothesis? That where we are all starting from, that the dengue is a climate-sensitive disease. Temperature and rainfall variations influence the magnitude and the seasonality of a dengue transition. However, what we're actually realizing that there is a huge challenge on the countrywide level, since dengue incidence varies across administrative areas, considering also climatological and socioeconomic attributes. In different areas, we saw different behavior, which connecting all those different variations. So actually, what really the task is nothing really strange and new, but it is what is it really came out as a strong task, as a strong challenge, is that how can we anticipate such trends that can help governments to implement an effective control measures and obviously mitigating the effects of the disease. And just to summarize this, it is really what we realize is the importance that public health policymakers, vaccine developers, and vector control specialists be provided with a robust estimates of the current and future and local distribution of the dengue. And that is where really it connects us the dots, and I bring Do from the scientific perspective. Over to you, Do. Thank you.
So with this given context, we have explored different options to accurately model this dengue fever prevalence. And we noticed that recent AI technology can dramatically increase the model performance and accuracy, especially where there are some missing data and noises in the data set. And then when there is a complex and non-parametric patterns in the data, and then we also identified that recent AI technology is extremely good at in long-term forecasting, and also much easier to do the feature extraction, which is done within the data set itself. However, we also noticed that in some cases, the traditional machine learning or statistical based model could work better. So we decided to, rather than depend on one single approach, but develop ensemble or harmonize the model between the different type of the models, incorporating the recent AI technology and the traditional type of the model. So this has been developed as this ensemble frame AI model framework, and we, as Hanoch briefly mentioned, we started with the context and the background in Peru. But when we started this project, we soon realized that the Peru data set for the dengue case was not really complete. So there are a lot of missing data in especially some of state and department. So we moved on to finish this model development in Brazil. And the model development has been successful in Brazil, and then again fine-tuned with the available data set in Peru and successfully applied in Peru context as well. So this work has been identified as the one of the global top 100 AI project by IRCAI under UNESCO, and also identified as a best of UNICEF research for 2022. So to develop this ensemble AI and machine learning framework, we have tested different climate and environmental variables. So majority of those data from Earth observation data, and also some of the geographical climatal data also explored. So this is not the entire list, but we tested using the vegetation or forest cover data and the NDVI and the height of the elevation from SLTM data, and other climate data observed by this satellite census from European Space Agency. So this shows briefly the type of the data that we have used in Brazil, including dengue incidence data for different states, and briefly showing the relationship with the air temperature and humidity. So you can see in many cases it has a very close relationship in terms of the pattern. This is the data that we collected from Peru, including dengue incidence rate. But also you can see that in some department and state, you see many dengue cases omitting from them, given that some loose relationship with the maximum air temperature and humidity. So that's actually one of the reasons that we drove our decision to first implement this algorithm framework in Brazil. So this briefly explains about the type of the AI framework that we have been developing. So again, this has been done in Brazil. First, we pre-processed those time series data that we've been collecting from satellite, remote sense data, or other socioeconomic or geospatial climatal variables. To reduce the data dimension and make it much easier to deal with the machine learning framework that we're developing, we applied the spatial correlation convolutional neural network. After we reduced the dimension of the data set, we applied different type of the machine learning algorithm. including cat boost, SVM, and LSTM, long and short-term memory. So based on this machine learning framework, we could combine different observations using the random forest at the last stage. So that we can finally get the dengue incident rate for the individual department. So this has been successfully implemented again in Brazil. And then, as you can see, we collected those similar data in Peru. And then we could fine-tune this ensemble AI machine learning framework, and then again applied in Peru. And then the results were much improved compared to our first approach developed in Peru. So this is actually kind of opportunity that we realize in between this development of AI algorithm, and that our model first developed in Brazil with the very good dengue cases data can be scaled up into different places, and even to develop the regional or global scale model. So here I present some result for Brazil from our model. So you can see that the green line is the baseline prediction from some previously developed model based on Bayesian statistics, and the orange color line shows the actual observed cases in Brazil, and the red line shows the ensemble AI framework-based prediction of our own. So you can see that compared to the baseline prediction from different model previously developed for Brazil, our prediction improves much. Compared to the previous one, much closer to the actual observed cases in different states in Brazil. So this is the another example of our result showing the cross the prediction across to the actual observed cases in different states in Brazil. So again, we fine-tuned this model and applied in Peru. So you see the results from Peru. Compared to the result from Brazil, our prediction is less, fit to the hikes in terms of the dengue prevalence in some places. But still, you can see that our model outperforms the previous existing model. So we can see that there is a lot of advance and progress in terms of the model prediction. But still, we may need more the cases data, more accurate data to make it more fit to the actual observation. So that's a brief introduction about the how we build this model and how the results was look like in different places. So Hanoch can again talk a little bit about our future directions based on our success in model development. Hanoch, please.
Thank you, Do, and really as a natural continuation of this work and results and conversations with health sector, with different entities, other UN agencies, government, obviously, science, academic. We thought that there is a space to continue and excel this work. In a nutshell, we put in four work streams that we see this moving ahead. And first, and as a overall umbrella, it's the expansion on geographies and diseases. As we could see, as mentioned my colleague Do, we would definitely want to look at this beyond the Latin America region and see how that could work in other places in the world. So the whole idea is that really using how can we operationalize it? How can we take it down to earth to make it as a management risk tool, creating a platform, an open source platform that could be used by the health sectors and the different relevant stakeholders to better prepare and respond to future changes in the dengue, in current and future in the dengue risk and incidents. What we also would like to continue is to advance all the scientific knowledge on environmental epidemiology, geographical and climatological factors that are responsible for triggering different types of disease transmissions. And I will end up with our really vision on the way forward and saying Excel creation. A fundamental component is the linking the different disciplines, different sectors, different institutions, and really further promoting the collaborative work among complementary expertise from an intergovernmental organization, public health, and academic institutions to advance knowledge and address social challenges. And all this becoming and end up in enabling the condition for safer and healthier environment for children and their communities. And we will stop here and pass it over back to you, Marianne. Thank you very much, and looking forward for a conversation after the following presentation. Thank you.
Well, thank you both so much. That's been an amazing presentation to kickstart not just this session, but also kind of building on the first one of the day, where we heard a lot of very just gaps, whether it be data gaps, cross-sector collaboration, also just some of that very basic scientific research that is missing in the impact of climate on health. And it's hugely inspirational to see this project that has such ambitious aims to address all of those. The fact that it's led by an organization like UNICEF is in many ways quite original. And so we'll come back to all of those things after Ayman's presentation, but thank you so much. That's been an incredible project. And Ayman, we'll hand over to you to hear a little bit more about your work, and then perhaps we can all come back together at the end of this and explore some of the big gaps that you're all tackling through your research and your work. Over to you, Ayman.
Thank you so much, Marianne, and thank you for the International Society of Neglected Tropical Disease for the invitations and coordination of this interesting seminar. It's always ahead with such an initiative. And thank you for my colleague who presented before me for setting the ground for the work on impact of climate change on infectious disease. Here I will present briefly about the impact of climatic change on infectious disease vectors, as well as outbreak of arboviral disease in Sudan. During the recent 5 years, different manifestations of climatic change have been observed and recorded throughout Sudan, including flooding and heavy rains throughout the country, with unprecedented record of high level of flooding, and that's not only disturbed the living environment, but also limited access to healthcare facilities, destruction of roads, blockings, and also affected food safety and other dimension of human being life. Also include sandstorms, as well as drought that also not only killing and risking life of animals, but also leading to gathering them in very limited spot in their search for water, and grass, which increase the contact between different animals from endemic and non-endemic area with infectious disease, which eventually increase cross-species transmissions of different viral infections. We jump over to the direct impact of climatic change on disease and infectious disease vectors. For example, during the last 4 years, we have seen that the emergence of Anopheles stephensi for the first time in Sudan and has been recorded in the eastern part of the country in the coastal area with the Red Sea. However, within 1 year or less, investigating historical samples from Khartoum have identified that the presence of Anopheles stephensi, which is a competent vector for malaria for both Plasmodium falciparum and Plasmodium vivax, has been reported for the first time also in the capital city of Sudan, in the central area of the country. Unfortunately, within 1 year after that, a countrywide national survey have identified that the vector has spread throughout the country, and was revising this record of presence of Anopheles stephensi with the event of extreme weather, including floodings and heavy rains. They are kind of matching or corresponding together. And it's alarming not only for Sudan, because as we can see here, we have recorded the presence of Anopheles stephensi in border with currently known three of Anopheles stephensi, like several countries like Libya, Egypt, Chad, Central African Republic, South Sudan. All of them up to now are assumed to be free from Anopheles stephensi. However, we have found Anopheles stephensi in the border with them, and we share open border with this country. Also, a recent study have identified another invasive vector in the country for the first time, Aedes albopictus, which is a competent vector of arboviral disease. And this first confirmation of presence of Aedes aegypti is associated with a major outbreak in arboviral disease in the country. Also, within the same study, we have identified change in the geographical distribution of some of the endemic vector in Sudan, including Aedes aegypti, Aedes africanus, and Metallicus, and Aedes vixans and Vitetus as well. All of these are competent vector for arboviral disease, and their distribution corresponds directly with recent outbreak of arboviral disease. As we can see here, arboviral disease, like for example, this for chikungunya, the blue, it shows the previous distribution of or record of chikungunya cases in Sudan before 2020. However, the red show the recent emergence of chikungunya outbreak in Sudan in 2020, 21, and 22. Also, as we can see here, recent outbreak of chikungunya, major outbreak of chikungunya actually has occurred in Chad with over 30,000 cases and over 40,000 cases in Ethiopia in 2019 and 2020. Which indicates like not only change in the distribution of competent vector, but also suggests presence of additional vectors and additional impact of climatic change in favoring the prevalence and flourishment of these vectors. Moreover, we have seen recently the emergence of Rift Valley fever, dengue fever in the western part of the country for the first time. Although dengue is endemic in Sudan for over 40 years, however, it have never emerged in the western part of the country before 2014. And 1 year later, we have seen a major outbreak of dengue fever across the 5 states of Darfur. Additionally, we reported the emergence of CCHF, Crimean Congo hemorrhagic fever, and West Nile virus for the first time in the region, as well in the same year, 2015 and 2016. And here, the blue, the heavy dark blue show the endemic area for dengue, which is in the eastern part of the country in border with the Red Sea. And the light blue show the recent emergence of dengue and major dengue outbreak in the western part of the country. More recently, dengue outbreak became more common, and unfortunately, vulnerable populations, those living in humanitarian camp, were hit the worst, with continuously ongoing outbreak of dengue fever and dengue and malaria concurrent outbreaks or syndemic outbreaks in the area. Moving to the eastern part of the country, where unfortunately it was hit with heavy rains and flooding since 2018 through 2021. The area have seen a lot of impact of climatic change, including the flooding, heavy rain, and more recently drought. However, we have recorded for the first time the emergence of Rift Valley fever in that area in border with Eritrea and Ethiopia. And this is very alarming for the security and global health in that area, considering the area considered a humanitarian area hosting over 60,000 of Ethiopian refugees. More importantly, also it's hosting the largest open pasture for cattle, which exported to different countries in the Gulf area. So having a dengue, Rift Valley fever to be established in that area, risking the local public health and the global health as well, and food security in the area. And in 2019, we have seen for the first time a unique outbreak occurring almost in middle of the Great Sahara Desert in the desert area of River Nile, North Sudan, where it has never seen outbreak of Rift Valley fever. And this outbreak was associated with actually early occurrence before the usual time for the rainy season in the country, which usually start from late July to or early August to November. However, this outbreak occurred between May and July in that year. And since then, annual outbreak of Rift Valley fever have been reported in the northern part of Sudan. Also, we can see that climatic change is not only affecting mosquito-borne disease, but also it has impact on the tick-borne disease, including CCHF, Kirmikango hemorrhagic fever, where we can see here a wide spread of Kirmikango hemorrhagic fever epidemic through the country. Previously, it was the disease was confined entirely to Kordofan area in the central area of Sudan. However, we see its epidemic recorded in the central of Sudan, like the capital city, Khartoum, as well as southern and western state, including Darfur region. And last but not least, unfortunately, we have seen that climatic change is heavily affecting people at humanitarian camps because their vulnerability and their lack of proper settlement. And among those populations, we have seen destruction of facility and wash-related disease due to contaminations due to flooding and destruction of facilities. And we have recorded several outbreaks among those vulnerable community, including hepatitis E and cholera, and as well as several arboviral disease. And for further reasons, I'll leave you with this list of publication for later read or revision. Thank you all.
Thank you very, very much, Ayman, and a huge thank you as well to Do-Hyung and Hanoch for the earlier introduction. We've been joined as well by Dr. Rochelle Schneider dos Santos from the European Space Agency. So welcome, Rochelle. It's lovely to have you here, and just can't really put into words what an exciting session this is, just kind of from the scope and range of speakers and the organizations you represent, also the collaborations you bring in. Ayman, you really gave us an excellent overview there of the invasive species. And of course, when thinking of climate change, vector-borne diseases are usually what first spring to mind. And with that, there's a kind of implicit a need for international cooperation to track and manage these invasive species. And likewise, with the AI project that you've described, there is already there the foundations of laid for a very broad international cooperation. So I suppose just to kind of kickstart our thinking and our discussion around these topics, what I'd like to ask the speakers is, coming from your different fields, whether it be climate, whether it be health, whether it be AI, or kind of the science of space and satellites and data and so forth, how have you found the collaborations across sector? What do you feel is missing from your perspectives and what do you to see more of? And what we're really thinking about is particularly inspiring anyone in our audience who's working in their field and would like to integrate a lot more sort of climate considerations into their public health work, or vice versa. Do-Hyung, would you like to go first?
Great, thank you so much. So that's actually a great question. So my work at the UNICEF, specifically at the Office of Innovation, is to connecting the dot between the demands from the field, from country office or regional office, with some new technology and new data set to build a new opportunity and a new project. So when I'm doing that, I actively reach out to the person who are doing these field operations and doing this support work at the ground level, like Hanoch does. So we've been active in that, but still there are missed opportunities where this link is loose, and also at the cutting edge.
Thanks. Listen, there's a very huge, immense experience, but I would really want to take the opportunity and give the floor to Rochelle that joined us, and because I think this is a very important component in this complementary collaborative work. And then if there's anything I will add, I would really want to give the floor to and the space for Rochelle, if it's okay with you.
It would be perfect. I was actually building up a crescendo to Rochelle's participation. I didn't get a chance to introduce you properly. I was going to do that. Rochelle, you are with the European Space Agency, but really interestingly, you also have this very strong multidisciplinary background in public health. You are, I'd say, close to my home because I live in London, but close to our hearts as well, as you work a lot with the London School of Hygiene and Tropical Medicine, and particularly as part of the Center on Climate Change and Planetary Health. So absolutely, if someone knows about the electoral collaborations, particularly in this very exciting field of satellite and space, would be you. So over to you, Rochelle.
Thank you. Thank you for the invitation to be here with you today. I'm very happy to join this conversation because I would say this was a great project we have done together with UNICEF. It was a great, in many ways, a great opportunity to meet people from UNICEF, to get closer colleagues from the UNICEF to collaborate with us and give us the reason to show off, let's say, the benefits of Earth observation and machine learning applications for public health and also to children, which is brilliant for us and then makes us very happy every single day to partner with them and then make this project. So the beauty, I would say, of this project is this close collaboration. Every 15 days we meet and then we discuss about results and progress, but not only about developing an algorithm about AI and then including Earth observation satellite data, Earth satellite-based data from maybe be able to build this from the scratch. So we were working together and making this totally in a format that would be able to be not only useful for that country, but also enable these to be transferred to other places. So, for example, we start in Brazil because initially Brazil has a huge amount of data for dengue, but we not only want to provide benefits from Brazil, but we want to provide benefits for the whole Latin America and then even other places that also have the same problems of dengue outbreaks. So this is what we were aiming here, and not only the total population, but also children that would be benefiting from that. And I remember that you also mentioned about what is missing. And in this case, I would expand this session to other sessions of the conference and remind that this conference has a great pool of researchers working on this specific topic, and they have developed a lot of great work on this topic. And then what is missing is making all this knowledge transfer to our operation system. So not only our project, but other brilliant work that have been done and then potentially will be presented in this conference, then make these actually going out of the academia and then make this operation. So that would be great to see. And I will stop here. Thank you.
Fantastic. A lot of food for thought there. And you're right, this is why having a partner such as UNICEF, who's not an academic, is very inspirational to see how you go about to marry all these different stakeholders. And for a few minutes to you, Ayman, on the ever fascinating and terrifying at the same time topic of invasive species. So lots of data there and lots of linkages between climate and, of course, your regional work. Looking at the international community, whether it be the international community working on climate or that working on vector-borne diseases, how have you found sort of the collaboration, the cooperation? What do you feel is still missing, and what would you like to see more of?
First of all, I guess vector-borne diseases are directly affected by climatic change, so we cannot work on investigating, preventing, or controlling vector-borne disease in particular, because it is the most obvious impact of climatic change. We cannot work on them in isolation from the others. Coming from background with medical entomology and arbovirology, and the challenge that for arbovirals is, in addition to the climate change, they are zoonotic in nature, so they are affecting human, animal, and environment as well. So I guess collaborations and appear among human animal population before the human, like for Rift Valley fever. However, vice versa apply for some other diseases like Congo hemorrhagic fever. So I had the privilege to be working with several veterinarians and environmental health specialists and physicians as well, and different people. And more and more I work on vector-borne diseases, particularly arboviruses. I find it mandatory to go through transdisciplinary One Health approach for investigating the real widespread of this disease, because working with one host, we cannot understand the disease as well. We cannot prevent or treat it or control outbreaks.
Sorry about that. Fantastic, absolutely. And I think one thing that really shines through from all your work is this drive and this real ambition to go from the data, but to effect real policy change. And so moving a bit to now governments or international organizations, I know we're kind of pacing forward towards COP27 now. How easy or difficult, or what are the steps in the way of governments uptaking your research and really using that as a leverage to affect policies that could help the impact on a country's resilience or just broad resilience, mitigation of climate impact? How's that dialogue going?
The main two challenges for government, at least in the region, to uptake and work toward integrated policy. People from different ministries to work collaboratively, especially during outbreak and health emergency due to their urgent nature. However, this require an earlier coordinations and structuring a new One Health surveillance system. So this is what we are trying to push right now, is installation of One Health with transdisciplinary approach to have one integrated surveillance and response system, where you have representatives from different ministries working under one roof with the one missions, instead of having the fragmented work for Minister of Health, independent from Minister of Animal Resources and Health, from Higher Council for Environment. So I would say funding and restructure, those the main way forward if they could be secured. And this urgently calling for international collaborations and consideration from large donors, because to restructure and to build this integrative surveillance and response system, it requires a lot of resources and changing the current system.
Brilliant. Thank you. That call for support has been heard loud and clear.
Thank you.
From the UNICEF ESA team, who would like to answer this point?
Well, I can just add a word here and saying that it's an interesting point and very important. If you want, I can take it to a broader discussion, where if you look from the climate perspective, traditionally the focus was always on the mitigation part, while slowly when you start looking at the climate agenda as part of the adaptation part. However, with the second round and towards the COP26 and now the 27, you could see a slowly and gradually increase in the adaptation as well as health, but still you require a lot of work. And part of this work also that we're doing, it's not only for the technical, but also for the policy level. So they are getting really provided with evidence, with a solid and robust evidence. It's really another drive for this work. So to increase all the component of adaptation while truly and rightly giving a lot of emphasis on the mitigation. But at the same time, we also have to realize that the adaptation component, adapting measures, strategies, and resources are equally important in this changing environment as we are witnessing on a daily basis. And this work in particularly, it's extremely important, exactly to feed in, but also to say that as we are working with the climate entities to increase adaptation and in those sectors like health, education, protection, nutrition, water and sanitations, etc. It is equally important to also to work with the different social sectors like health sector, so they also understand what are all the implications of the climate change on their sector, and they're also endorsing it and developing strategies as integral part of their agenda. So it's not something as extracurricular to their agenda of building their sector resilience. And you know what? Unfortunately, we were witnessing with the global pandemic that we had recently, how the health sector, as other sectors, were caught unprepared. This is just a kind of a call for all sectors to gear up on their resilient capacities. And this is exactly a good example of what we are trying to do, build the managerial tool so health workers could use it for their daily use in building their resilient capacities. And I'll stop here. But this is exactly, it was a very good, and thanks for bringing it up. Over.
Hanoch, your enthusiasm is amazing. I mean, you've been deep into this approach and this framework. So I guess for you, it's second nature. But I suppose to a lot of, as you say, health colleagues or who work really specifically on disease, it's a lot to take in, and in a good way. But I guess there will be some level of a learning curve to start to think really in these very big dimensions, and also perhaps an element of, well, I don't really know how to untangle all this to incorporate this into my health or disease or parasitology research, or where do I start? And perhaps there's also a level of, we discussed this at length in the first session, kind of the jargon, a lingua franca. So what would be your advice or your views on how all these different fields that we're marrying today in this panel, just in this panel as an example, how can they communicate better? We've heard a bit of how you can work together with your wonderful projects, but in terms of communicating, and I guess we're talking about, just understanding each other, learning about each other's sectors. What would be some of the good ways that you can see moving forward, whether it's for health colleagues or likewise for climate colleagues who equally don't necessarily always put health at the center of the approach? I'm not sure who'd like to go first on that one.
Toward creating a unified platform for such communications. And I believe it would be great and helpful for all sectors if such platform could be available throughout the year, to be like in a form of assistance where timely sharing of information and challenge and resource mobilization could occur across different sectors, and not only within one country, but multi-country, especially that most of climatic change affected health issue, food security issue, and environmental issue are like occurring through different countries. They don't know or they don't abide by international border or whatever. So if such platform for time communications, collaborations, and cooperations could be available, it will help everyone in every sector, regardless of their background. Over.
Yeah, from my viewpoint, this line of the work and collaboration, the data availability is a key. So, I mean, there are many sectors that actually collecting some their own data, and there are lots of available data publicly available out there. But sometimes it is very difficult to collect everything that works for different places. So this kind of effort should be also be supported throughout these funding opportunities, or as a collaboration and collaborative effort, I would say. Thank you.
Rochelle, perhaps you had a few words to add to this.
Yeah, of course, journal paper and finish our collaboration. We wanted to capacitate other people to do that. Mm-hmm. So in our project, we try to use everything that was open source, since from the programming language that we were using to the data that we were including in the model, all the machine learning packages, everything that was able to be replicated. And then not only making all these algorithms accessible to other people, but also doing actually a document where we described what we have done, what was our mindset, how we linked satellite with socioeconomic data, with the dengue incidence rates in Brazil and Peru, for people to understand what we were doing together. Like, after once they are reading the documents, they are with us in the mindset, in the co-creation of that project, and they are able to understand what we have done, and then to be able to do this in other place without feeling lost and feeling overwhelmed by the just reading a publication on the topic.
Fantastic. And I think this brings our conversation somewhere really interesting. And unfortunately, it seems that Professor Tulio, who was going to join us, hasn't been able to connect yet. Sorry, Professor Tulio de Oliveira from Stellenbosch University, where the recently launched Climate Amplified Diseases and Epidemics Consortium has been launched, CLIMATE. And that really is an effort to boost kind of the leadership of the Global South in climate and health research approaches and ultimately solutions. And so just based on your experiences and your views, what do you feel would be some important steps to take, considering that a lot of the Global South is facing the consequences of climate change, yet have contribution of the Global South in tackling climate and health?
I could start talking, but then I push Hanoch with me on that, because actually something that we talked a lot in our meetings about the current project, but Hanoch always mentioned that because it's his vision. He wanted to talk about the climate change and how the temperatures will change over the years, and how much this would affect the increase of dengue incidence in different places, and how much this would affect children in the future. So one thing that we should be looking forward and pay attention on that, and of course I'm quoting Hanoch because this is his mind behind my talk now, is look for projections, using the climate projections, the future, what's going to happen with the impact of 1 degree, 2 degrees in our climate, but how the outbreaks, the incidence of dengue will change together with the climate change, and then trying to analyze how much will impact children on that and everyone in this topic. And now I'm going to give the floor to Hanoch to finish this mindset.
Thank you, Rochelle and Marianne. No, I would just say that, yeah, first, I would say first come first, and we need to continue and pursue good data, reliable evidence, that it is also understandable, to bring it down to earth, that the different disciplines can read and understand this in a very simple fashion. And what is one of the things that, as we said, is to bring all these giant ideas and technologies very down to a very user-friendly mechanism, tools that could be used. Also, that evidence become much more, as mentioned here earlier, open source, available and easy. And so it's not necessarily that you have to have a certain level of degree to understand everything. Yes, you do need this, but you also need to bring it down, so to get the broader understanding. And really that what my plea to the health sector is that more and more asking and demanding to have climate and environmental components, technologies, bringing all these, take the advantage of institutions like the European Space Agencies and others that bringing so much know-how, so much technologies, and bring them down to have to be used and to really benefit from all this. As there was this great experience working with the European Space Agency, as looking forward to continue using all these beautiful, interesting technologies for the benefit of those that most affected, but not only those affected, because at the end of the day, the point is that we are all affected in different ways. And that's what this is the big challenge to understand. So my plea is that we have to open to work together in a more multidisciplinary fashion rather than silos that traditionally we used to work. I know it's words, but that's at least from UNICEF perspective, we are trying to open those and making the links between the different sectors and the different levels and layers. And I will stop here. Thank you very much. It's been a very inspiring discussion. And I also, Marian, just to say, I'm reading the chat and the comments, very interesting ones, and we will definitely, it shows how much there is a space and need for this kind of a dialogue between the different entities, etc., etc. So I hope that, so first, thank you very much for bringing this topic, and hope that we would be able to keep the dialogue and to flower and to make everything a bit more resilient. So eventually we have the current and the future children growing in a more safer and a sustainable environment. Thank you.
Absolutely, that is the common goal. And although you said it's just words, and it's true, it's easy to say, let's break down the silos, but then how do you do it? And then, as you say, as a start, and the next step is how do we go about that? And hopefully this meeting will just go a little bit of the way to putting that in a bit more of a practical motion. You're right to highlight the chat and the Q&A. There's been some really good conversations there, which I thought we could bring a bit more into the open for those that aren't on the chat. But before we do that, I just wanted to turn, I don't know if Do or Rochelle, you wanted to add at all, and also to Ayman, to have your views, to really understand a bit how you feel the Global South could be put a bit more center stage in terms of tackling climate and health.
Yeah, most of the comments I actually have seen in the Q&A section is about the needs and demands on the open data. So some of them were asking if any kind of data or platform is available for Africa or different places, for example. So actually, I was answering that this is actually the direction that we want to take in the future. So we are actually joint force with the other collaborators like UCSD and other companies, etc. So to move forward with the already established and developed method and the framework into different geographical, the area extension and the other, type of the tropical disease as well. So we are aiming at building this kind of, open platform so that people can come and collect and share these dengue cases or in other tropical disease cases from in the future as well.
That will be huge. So watch this space, everyone. Over to you, Ayman.
I can't agree more with all said by my colleague for the need to transdisciplinary collaborations and joint work. And I would take this opportunity to emphasize on the need for transdisciplinary One Health approach, single structure health systems. It's not divided into many at the current situations. And if we had this single structure with everyone from different disciplinary and led by climate change specialists, so we can be more proactive instead of responsive, because response it's resource demanding more than preparedness. Also, you lose a lot of life and resources due to late response for health emergency and response. And that's why I guess having a shared platform throughout for multi-sector, it will help not only in generating and providing up-to-date data, but to make utilizations for of this data on time to prepare and response. And regarding the contribution from the global south, I guess, unfortunately, it's mainly the resources and lack of advanced tech, and especially for the training for climate change specialists in some many countries. It's the situation until its outbreak occurs, because before the severe impact of climatic change, disease dynamic occurrence of outbreak, it was more or less usual, in that specific area. We will have dengue, like in the eastern Sudan. We know, like, annually dengue, it will occur only in the eastern part of the country. However, now no one can tell us outbreak start in the western part of the country even before in the eastern part. They suddenly develop in the southern. We suddenly had Rift Valley fever outbreak even before the usual rainy season in the northern part, which is in the middle of Great Sahara Desert. So without remote sensing, climatic change specialists, and collaborations with people from veterinary, environmental, human health, and physicians, researchers, and academic institute, and more importantly, donors and international organizations, including different UN agencies. Unless we agreed, and I guess all it is a good initiative. However, it still lack existence or presence at country level, because it's still at the headquarter levels. I guess they still developing health recommendations, what's to come next. However, it lacks funding modalities and presence as the field. And I guess hopefully, if this improve in the coming months or whatever, because it's currently limited. It's not something in the future. And finally, I would add that it is very alarming that a recent study about the impact of climatic change on viral emergence, in addition to what we are all seeing about the pandemics of animals and within a species, increased more than 4,000 times. That's is so terrifying. So we have more pandemic to come unless we took action at right now or immediately, and we collaborate all together. Thank you. Over to you.
That's fantastic. And if you want to hear more about partnerships, tomorrow, the second day of this event, is all about partnerships. So please don't miss that. Before we kind of wrap up on this session, there was actually a very simple but really good question in the chat from Kingford Chimfwembe. And Kingford was just asking, this was addressed more to Do and Hanoch, based on your presentation. Has your model been tested in African countries? And I see you have replied to that in the chat, but I thought we could discuss that here. Has your model been tested in other countries? And if not, is this in somewhere in the pipeline? Are you planning this? How will you go about this? And equally, Ayman, for your work, what could other regions or even colleagues working in completely different vector-borne diseases, I'm thinking about Chagas disease maybe, what could they learn from your approach or from what you've been doing? I'll hand over first to the ESA and UNICEF team.
Yeah, I think, the best person to, answer about this question of the scalability of this model is Rochelle, which basically worked on this model itself. So I'll, take this after she answered this question. Yeah.
Well, this algorithm to another country. And then that's what we have done in Peru. And then you probably saw on some slides that we, Hanoch and Do have shown. And that's a great idea of making this replicable to a different context and the different satellite products, and then perhaps a different context in the land. So definitely something that would be great to explore and see how well the model can transfer for another locations that are far away, and that maybe has also different behaviors in the climate conditions. And just to remind you that the satellites are orbiting around us and there is no boundaries on that. So everyone can access this data and it's available to everyone. So the data that we have used from satellites in Latin America is able to be used as well in Africa and different countries there as well. So this is what I mentioned in the beginning. We working together in something that we are thinking about other places, about other communities that will be able to benefit from it, because even if we change the settings, these people will still be able to download the same type of data from the same website to be able to do the model in another place.
Yeah, so when it comes to the model development and enhancement, there are lots of things to be done as well. Because when we want to bring it into the different contexts, we have to consider different relationship between the climate and the people's behavior or social structure, etc. So probably there are some missing links in between this model donkey to have Hanoch in our team, so that we can reach out to the people actually been collecting this data from Peru and Brazil. But we didn't even in the UNICEF, we don't really know what kind of data is out there, who've been collecting this data in, for example, African countries. So Hanoch can best answer on this kind of questions and topic. But probably we can, dig out a little further in terms of the availability of those kind of data. Hanoch, please.
There's not much to add. A lot already been told, and we are looking on how we could expand this and collaborate and communicate with different, well, we were hoping to have a ministerial representative on this panel, so we could have a bit of this kind of discussion, because what we are doing now is having this dialogue conversation with the health sectors, with the different ministries, and to see what is it exactly that they are looking at, what will be serving them to move on. And also in terms of data is always a challenge, but there are always solutions for data. I think also things are getting better with the time. The demand also create new data, new availability of data, the technology bringing together. So data, yeah, it is a challenge, will be a challenge always, but I think there are ways to overcome data. I think what is it really important is this dialogue and work together with health sector, understanding their needs, and so they also understand that they need, because sometimes it's not obvious that there is a need for such work. So it is an ongoing. We also hope, and I thought it came out also from the presentation, that one thing is the change in incidence. The other thing is emerging new places with the diseases that before were not there. In Europe, we heard that we could also see cases of dengue in Europe, something that nobody would think about this earlier. But so this is part of the work also to anticipate not only the change of behavior, but also new geographical areas. And therefore, eventually what we hope that also with very limited data, we could expand the work. But this is a work in progress. This is really, we are in this junction where we realize that, first of all, the technology works to our benefit, and we learn we could really use it and develop now. the next step and make it, disseminate it, make it something a bit popular, if you want, a bit more common. And this is where we are going. And we will get there. Hopefully in a year time, when we meet again,
yes,
we could report on governments that could use the tool for their benefit and better prepared to respond and mitigate arboviral diseases like the dengue and other neglected diseases. So that is what we're looking. We cannot promise much. We are working as we learn, as we get collaborative with governments and other entities like universities, like the European Space Agencies and other entities coming together and excelling and moving further with all this together. And then at the same time, I would say also extremely important that we are bringing climate entities to the discussion. So it's also coming on their agenda as well, all those elements of like health sector and others. But this is really my appeal, is that let's not keep silent and let's not take things for granted. We do need to open doors. We need to go and knock on windows and doors of the neighbors that sometimes we think we're taking for granted that it's obviously there, but we will be surprised to realize
anxious, no pun intended, and we really look forward to seeing where this project goes. It's given us so much to think about, I think, to anyone who's in public health or in NTDs, and you might have come to this event with a bit of curiosity about integrating climate into their work, and your project has, the three of you have shown us there's so many dimensions to it, and how much can be done and explored. So it's been really wonderful. We will definitely meet again next year, so we can put that in our diaries. And perhaps just in the last few minutes, I'll turn to Ayman and ask the same question about scalability or sort of lessons learned for other regions, particularly invasive species. I mean, there must be a lot there that colleagues in other continents or countries can really learn from you. And what are your plans for the future?
Thank you. Before attending to the question, I would like to thank so much my colleagues, and I can say to them that Sudan will be one of the countries that will benefit greatly from your modern and climatic change expertise. We have the wide range of arboviruses in Sudan, and they are increasingly outbreaking throughout the country. And hopefully, by the next times we meet here, we'll have already established some joint work regarding sharing the experience and how countries in the region benefit. There's a lot to be shared. We have learned ourselves from our colleagues in the regions regarding the surveillance, and now we are trying to share or in West Africa, which is really alarming. And hopefully we will have a similar system for Aedes albopictus, because also it is spreading throughout the continent. However, the work is progressing slowly, but that's the nature. With more advocating and promoting for transdisciplinary collaborations, multi-agency, multi-country collaborations, I guess we will get there, because we have to do that. Vector-borne disease, climatic change, and zoonotic disease, they know no border, and we keep sharing them. So it's better as well we collaborate on controlling and preventing them altogether. Thank you, and over to you.
Brilliant. I think those are some really great final words. I know the audience will join me in thanking you all very, very much. And we're really looking forward to hearing more about where all this hugely inspirational work will go. Rochelle, Do-Hyung, Hanoch, Ayman, thank you so much for being with us today. There's never enough time when there's so much going on. So, but a lot of your messages resonate with us. To our audience, thank you as well for tuning in. We hope to meet again, as we said, next year. And in the meantime, all the best. And again, a very big thank you from the ISNTD and for everyone who's going to be watching this. Take care.
Thank you.
Thank you so much.
Bye. Thank you.
All the best. Bye.